What's up, you guys? This is your boy Miguel, giving you your daily dose of radiation. Today's video, we are covering the importance of the X-ray tech and our vital role at the hospital. So to give you context, I am a night shift X-ray tech. Been doing it for about 4 years. I dabble in both days and nights. If you are new to our profession, if you are heading into the workforce, I congratulate you in your journey, but just be aware that majority of the times we are, how do I say it, not like they don't value us until they need us. That's how the kind of situation, because the nurses, my lady is a nurse, they get all the credit, they get all the hurrah, they get all the holding it down, which they do. I mean, they do a lot. And then we don't get the credit until they need us. Just putting that out there, if y'all let them know. You don't know how many times I've been out there doing my job, just x-raying, and nothing. Trauma comes in, GSW, this and that. They're like, get x-ray. We need x-ray. We need to know where this bullet is. I'm like, ha, you need me. I was like, And then, of course, like, you shoot x-rays, and then, like, the film comes up, and then you're like, it's right there. The bullet's right there. Maybe patient has a pneumo. Maybe, like, you saved the person's life, and the doctor thanks you, and then you have a little credit. You know, kind of makes you feel good that you're needed. But majority of the times, it's not like that. So just be aware, if you're joining our profession, majority of the times you will be, even just in x-ray as a whole, we are at the very bottom, almost, it feels like, because I mean, at the end of the day, it is a business like anything else, and whoever's, I would assume, bringing in the most revenue, gets all the new toys, gets the most gadgets, keeps them up. Because there's been times where I've looked at our department and I'm like, we're just like running on hopes and dreams and just tape and a bunch of just like patching it up and not really fixing it type situation. So if you're joining our profession hoping that, I mean, we do day by day, more of a like individual patients who will kind of make a change, and like majority of the times you're going to be pissed at you because, you know, their bone's hurting, they're in pain, but we do play like a big role, because like between, like, it's always like the nurses, x-ray, and then respiratory. Those are like the three main ones. If you work at a hospital, those are like the three, I guess you could call tools that the doctors have, that they use. Sometimes I feel like we do get abused, because sometimes they're like, what's the easiest thing we can do so we can discharge the patient? And they're like, we can just do an x-ray. And like, sometimes it's up to us to be like, hey, why are we doing this? And they're like, and I'm like, you know how unprofessional that is, sir, to just order x-ray because it's the easiest thing to do so you can get rid of them. Like you see, like, sometimes you have to be aware of that, because it does happen. And it's mainly not to like the regular day-to-day people. It's mainly of the, how do I say it, the people that don't have a home, I guess, that are just trying to, like, especially if it's cold, that they just want somewhere to stay at for a little bit and rest. Those kind of situations, which is unfortunate, but you see it a lot, especially if you work the night shift. You will see that a lot of times. I mean, I enjoy our profession. I'm sorry, the lighting's messed up. I enjoy our profession a lot. I mean, I think you can, as far as day-to-day achievements, there ain't really much to like achieve as far as like other companies, like corporate goals. I mean, the only thing you could do is maybe have higher level skills and like expose less patients and be able to get like the x-rays done in like one shot. Like that'd be about the most as far as stuff you could work for. or better patient care, better communication. But as far as like overall arching goal of like some of the other companies that have like, oh, we have to do this project, you really don't have that in our world. It's just every patient that comes in, try to do the best job, try to get the best images. That's really about it. And I would say we pay, depending on the situation, we do play a life or death situation on some of these patients, because like they could sit there all day, listen to their lungs. They can sit and the nurse do the nurse stuff. My lady can do her stuff. But it isn't until they actually have the picture and they can see, oh, he has pleural effusion. Oh, he has pneumonia. Oh, he has a pneumothorax. Oh, he needs a chest tube. Some of the stuff they won't know until we do our job. During certain patients, we do have higher priority than the nurses do. Sometimes it's just a constant battle between the nurses, but I would say we're just like slightly below the nurses sometimes in some aspects of it. In other aspects, we shine higher than they do, but we usually don't get the credit we deserve. But you know what? If you join it, I think it's a good choice, because my lady, every day she's stressed as a nurse. I, on the other hand, I'm living my best life. I am not stressed, and I enjoy our profession a lot. Yes, but where we go. See you on the next one.